On the bespreek met die mense van Buckley West. Thank you very much, program directors and Dr. Pasha, with your broken Afrikaans. Very broken. The Premier of the Northern Cape Province, Dr. Zamani Soul, the Minister of Health, Dr. Pasha, our Deputy Ministers, Deputy Minister Muloi, Deputy Minister Dr. Mhaule, Deputy Minister Mafu, and Deputy Minister Dr. Dlomo, our mayors, the Deputy Chairperson of SANAC, Ms. Steve Litsike, the Chairperson, this case we have got the Deputy Chairperson of our Private Sector Forum, Dr. Hopane, the Deputy Chairperson of SALGA, our MECs present, representatives from the UNAIDS, World Health Organization, and representatives from the US, our religious leaders, Deputy Chairperson of the National House, thank you for gracing this occasion. Our interfaith leaders, all our traditional and quiescent leaders, our traditional health practitioners, our development partners, distinguished guests, ladies and gentlemen, good afternoon. Goeiedag. Is that correct? Today, we gather here at Buckley West in the district Francis Bart to commemorate the World TB Day. This is a day when Dr. Robert discovered the bacterium that causes TB, thus paving a way for the diagnosis and cure of TB. Since then, life has not been the same. Our life has changed. We've been running after this disease. In a similar way, we responded to the COVID-19 pandemic when it hit us 2 years ago, as we adopted measures to respond to the pandemic as a new health and a socio-economic challenge that faced the country for the past 2 years. However, as a country and the society, we've found a way to coexist with the virus. We've established ways and means to live with the virus. We have observed a number of protocols that were established through our disaster program. Now we know, as a people, as a society, we know how to live to avoid COVID-19. We know that there are appropriate vaccines that have been developed to protect us. By taking these vaccines, we will be protected, just as we will be cured from TB by taking the correct medications. We therefore commemorate this day to raise awareness about TB itself in order to reinforce the long-standing established health protocols and as a means of intensifying our efforts in ending this disease as a global health threat. The World Health Organization tells us that TB remains among the top leading causes of death in the whole world. For South Africa, this is true. Even though TB is preventable, even though TB is curable, in our country it remains one of the leading causes of death. What an irony that in this district, Francis Bart, this is the highest district in terms of the TB prevalence. This is the district that is hardest hit by TB prevalence, even though the population of this district, the population of this province, it's very small and dispersed. It is for this reason that we chose, Honorable Premier, to come to your province, especially to Francis Bart, mainly because of the mining activities that's happening here. A lot of our people are suffering from TB. But Francis Bart is not alone as a district. There are a number of other districts in other provinces with the high burden of TB. It is precisely for these reasons that we have resolved to rotate the commemoration of this day so that we can reach all those TB high burden districts of our country. By bringing this commemoration we meant to find the missing TB infected persons. We meant to help find the lost to follow up TB infected persons. We meant also to help fight and combat stigma and discrimination. And we meant to remind our people that TB is curable. You don't need to die of TB. We are pleased to note that the continuous progress that the country has made in fighting TB, the TB Caucus Secretariat within SANAC. We want to applaud them for their encouraging efforts in establishing TB caucuses in all the 9 provinces. This forms part of our global effort, our global TB caucuses that is made out of more than 2,300 members from more than 130 countries across the globe. This is purely an initiative very important in enabling legislators to advocate for the financial resources that are needed for the TB response and to marshal policy reforms necessary in TB program implementation. 2 weeks ago, Limpopo became the latest province to launch its TB caucus. I'm told yesterday, Gauteng also joined to launch their TB caucus. I don't know about the Northern Cape, Premier. On behalf of SANAC and the country, would like to congratulate these 2 provinces for the progress they've made in the fight against TB. We are taking comfort that as a country, we are united in our fight against TB, HIV, and other opportunistic infections. It is through this unity of purpose that we can effectively tackle social determinants that fuel the spread of the disease. With the launch of the SANAC Private Sector Forum last year, our united front to fight TB has been further strengthened as we now, all of us, speak in one voice to advance the health and human rights of the people living with TB and our people living with HIV. This united action in the fight against TB, HIV, and sexually transmitted infections helps us in sharing experiences, pulling together resources, and expanding our reach in order to bring everyone who is infected into treatment. It also ensures that we mobilize the necessary human and financial resources required to strengthen our health system, thereby improving the quality of our health outcomes, especially for the most vulnerable in our informal settlement, in our rural villages, and many other strained communities in the country. Where previously we may have been working in fragmented manner, such unit of purpose will ensure that we work in a much more coordinated and efficient way and make quicker progress. Our collective and joined-up efforts, and further strengthened by the pledge being made by our traditional leaders and cohesion leaders, our interfaith leaders, as well as the traditional health practitioners around the country, to work with government in scaling up interventions that will end TB and HIV as a public health threat. It is this sector we have found champions who are willing to raise their hands and ensure that social ills in our communities are confronted and tackled. In them, we have renewed hope that prevention measures against HIV transmission, the prevention of the spread of TB, as well as the fight against substance abuse, teenage pregnancy, and gender-based violence and femicide, it's intensified. It is the same active participation of these social partners that has made meaningful contribution in our forward movement in the fight against COVID-19. These mobilization efforts seek to translate into action the theme for this year, which is to invest in action to end TB now, get screened, end stigma, and save lives. It is a theme that calls on every one of us as South Africans to invest in various attempts, various actions to contribute towards national and global efforts to end TB. This theme is aligned to the global theme to invest, to end TB, and save lives. A call to world leaders in various sectors to ensure that sufficient resources and time are made available for the TB response. This investment includes policy shifts, financial resources that must be availed, and our daily actions as individuals in order to end TB. The case for investment goes beyond the monetary aspect, as it also speaks to the little actions that we take as individuals towards contributing to the ending of TB, such as deciding as an individual to get screened, to start and stay on treatment if you are infected. The theme also encourages for agency in prioritizing TB prevention, diagnosis, treatment, and care. Although, as a country, we have made much progress towards ending TB, we must admit that the COVID-19 pandemic and the emergency response towards it reversed some of the progress that we had made as a country. That as it may be, it should not be an excuse on our side for us to decry this situation, but rather it should be a situation that poses an opportunity for all of us to work together and work harder and with more urgency to catch up and to save more lives. We need all hands on deck when advancing the TB agenda. To this end, SANAC has established the TB technical working groups with representation from key role players, inclusive of government, civil society, and our development partners. Each stakeholder must be counted in our national efforts against TB. At our last year's commemoration of World TB Day, we received an impassioned plea from the sector of people living with HIV for government to declare TB as a national emergency. In response, family. This plan will help us to come closer to eliminating TB as a public health threat. It will also help us to address challenges that are posed by COVID-19 pandemic and close the gaps in the TB care cascade. Finding the missing undiagnosed people with TB linking them to quality care remains a priority for us as SANAC. Therefore, there are 4 key areas that we have prioritized to this TB recovery plan, namely finding the undiagnosed people with TB in our communities. This includes the Health Check mobile application for TB that has been recently developed with the aim to mobilize more than 1 million people in our communities to check their symptoms and assist in linking them to healthcare facilities as needed. To this, we must thank the pledge that has been signed by traditional leaders, our interfaith leaders, to work with government to find these undiagnosed people. Strengthening the linkage to care by making sure that the patients diagnosed in hospitals and in our primary health care facilities are linked to quality TB care. Strengthening retention into care by ensuring that patients complete their full course of TB treatment. Interruptions in treatment have serious consequences for ongoing transmission and sometimes leads to a resistant form of TB. And lastly, TB prevention by strengthening infection control mechanisms and treatment of latent TB, including the use of newer, shorter treatment regimes. We are pleased to announce that some components of the TB recovery plan are already implemented, such as the outreach activities to screen, test, and link individuals to care. We've been doing this in this province since the past Monday. Sitting here, I've seen our people going out of those marquee there, taking their screening, taking their tests. This is a sign of encouragement. Furthermore, this year we will conclude the current National Strategic Plan for HIV, TB, and STIs for the period from 2017 to 2022. And we are in the process of developing the new plan for the period of 2023 to 2028. Therefore, today marks the official launch of the new strategic plan development process. The plan provides for a renewed sense of hope and vigor for the people living with HIV and will be the last one towards Agenda 2030. We have thus far made some inroads in this regard, including securing technical and financial support from our development partners like the UNAIDS, our World Health Organization, UNESCO, UNICEF, our Global Fund, PEPFAR. We appreciate their continued and valuable support. Although we have had a number of challenges against efforts for epidemic control, South Africa has managed to meet and surpass the first 90 of the UNAIDS 90 targets, which its people knowing their HIV status. We must now work harder and more diligently to meet the other 290s of those that are diagnosed with HIV and AIDS, being on treatment, and those that are on treatment having their viral load suppressed. All these are aimed at accelerating our efforts towards the new targets of the 95, 95, 95. We believe, as the SANAC family, as government, that if we work together, we can achieve these targets. This World TB Day commemoration also marks and celebrates the comparative advantage of the South African National AIDS Council's unique coordination role. Furthermore, through SANAC, we have ensured that robust monitoring and evaluation in line with Goal 8 of the National Strategic Plan for HIV, TB, and STIs that calls for the strengthening of strategic information to drive progress, the achievement of our goals. We have established the SANAC Situation Room, which is an innovative data platform which allows decision makers, program managers, and implementers to analyze and view HIV, TB, and STIs data as and when they need it. The SANAC Situation Room will ensure that HIV, TB, and STIs data, transparency, and quality at national, provincial, district, and local levels are readily available. At a click of a button, it will be now possible to visualize performance nationwide against set targets for HIV, TB, and our STIs programs for different populations as outlined in our National Strategic Plan for HIV, TB, and STIs 2017 to 2022. This year, theme for the commemoration of the World TB Day, also focusing on combating stigma and discrimination against those who have contracted TB as one of the most serious hurdles in our HIV and TB response. We all have a responsibility to show care for those who are diagnosed with TB in our communities and encourage them to seek medical care rather than stigmatize them. The 2021 Global TB Report made findings that reduced access to TB diagnosis and treatment in the past 2 years has resulted into an increase in TB deaths in South Africa. This cannot continue. It is important to note that the year 2022 marks the 30th anniversary of the development of the AIDS Consortium Charter for Human Rights for people living with HIV and AIDS. We are currently updating the charter, with the process having started in Limpopo, Mpumalanga, the Eastern Cape, and in the next 6 months, consultations will be done in all provinces. We are expecting to launch the updated version of the Human Rights Charter on HIV and TB for key and vulnerable population later this year during the commemoration of the World AIDS Day on the 1st of December 2022. Our fight against TB remains strong. We are encouraged by the courage of all of us in the SANAC family to win this battle. Let us today further commit ourselves to making the required investment to making the required time to end stigma and save lives. It is through such a united approach that we'll be able to end TB-related deaths by 2020. TB is curable and TB is preventable. We want to thank the province, the leadership of the Premier, the leadership of the MEC, and the entire Executive Council in the programs that they are running in the province to end TB. We thank you for the partnership that you are taking with all the mines in the province. We've witnessed the work done by the mines, which is commendable, and I'm sure other provinces can learn from the work that you are doing. Thank you very much. Thank you.
Thank you very much. Deputy President, the co-chair of the South African National AIDS Council. The message is clear. The message is well taken. At this moment, before we call the Speaker for the vote of thanks, Premier, Deputy President, we want to